And I think we have time for some questions now. And let me just take off with one question to you. What is the main dietary source of aluminium? It's from the water.
Yes.
The relationship between aluminum and Alzheimer was because in the zones, areas where the aluminum in water, of the drinking water, was higher, there were more incidents of case of Alzheimer. But the principal source of aluminum is the water. It's not the.
So it's coming mainly from the water.
The sangus inside, no.
Yeah, okay. What about all the supplements or the medications people they take for heartburn, etc.? It's also aluminium.
Yes, it's another source.
Yeah.
Mm-hmm. But the aluminum, the absorption of the aluminum is very low.
Okay.
It's very low. Okay. But it goes direct to the brain.
Mm-hmm. Doesn't sound good. Okay. Okay. Ken, you have a question?
I have a comment because you talked so much about HOP. And in relation to type 2 diabetes, where we see a reduction in the risk of getting type 2 diabetes, and also obesity, as Arne mentioned. There has been a recent very interesting Japanese study of Morimoto Kobayashi. Did you get it? Morimoto Kobayashi in a nutritional journal from last year, where they studied addition of 35 milligram of major hop bitter acids, which is oxidized hops, in 100 subjects, and in the other group they got no of this added to. In both groups they had 350 milliliter beer per day, and they followed them for 12 weeks and made a CT scan, and then they found there was significantly lower visceral fat in the group that had received this major hops bitter acids compared to not. So I think that is very interesting, and there they have focused on one issue, because my question, this was a comment, and I have a question to you, because hops is hops, or there must be different hops. In my, it can't be, there must be also how major and not how major, and what are the substances, bioactive substances in it. Doesn't it differ from hops to hops?
But
I have never heard.
I think let's just take a couple of questions from the audience. Yeah, we have one here.
Okay, thank you. English or Spanish?
Spanish, please.
What do you prefer?
Have you taken into account the possibility of evaluating microbiotics, analyzing the neuronal activity and the stomach activity? Yes. The next step we would like to take in our different studies that we carried out with mice, well, the next possible step would be to apply this to humans, of course, and we've considered analyzing microbiotics. We're all still in that step. Count on me. Yes, of course.
Microbiota, yeah. Very good question. Do you have another over here?
Very nice presentation. Just a question for both of you. Recently, there's a new hypothesis that suggests that Alzheimer could be due to neuronal insulin resistance, and they call type 3 diabetes. As moderate beer consumption decreases insulin resistance, could be also another mechanistical way of acting, preventing Alzheimer's disease. Do you have any opinion about this?
I would say there is a lot of research just now on treatment of type 2 diabetes with GLP-1 receptor agonists, and there has been hypothesis that it should reduce the risk of getting in humans, but you see in the PET scans and so on changes in the glucose metabolism, but there has not, to my best knowledge, been any evidence that shows that it reduces it. But I must admit that I do not know very much about Alzheimer in connection with diabetes otherwise.
But I think isn't that correct that the observational study supports that that intake of beer reduces the risk of dementia and Alzheimer's disease?
Bueno, sorry.
Yes. Well, before these studies, we decided to establish the content in different mineral elements of Alzheimer's patients as well as Parkinson's patients. And it was then that we had the idea to really analyze the different elements that take place, the mineral elements that are present in the disease. Are these elements present as a cause or as a consequence of the disease? We saw that Parkinson's patients had a reduction of zinc as an element. And this led us to try and analyze the different antioxidant activities that were taking place in the patients' bodies.
Zinc and aluminium in these patients, whether in blood or in brain? Or?
In líquido cefalorraquídeo.
In encephalorhabditic liquids.
One over here. It's here, just behind, here in the dark. Thank you.
In the back.
First of all, I would like to congratulate both speakers because I have enjoyed very much the session. Thank you so much. And I have a question to Professor Hermansen, which is, could you please comment briefly on those mechanisms that are thought to contribute to the benefits observed upon beer consumption on diabetes type 2? Are they all related to insulin or are there other ones?
Thank you for putting this, I would say, very difficult question forward. As I mentioned, there has been studies showing that there is, in people drinking beer with alcohol, there is a reduction in adiponectin, and there is also, there is an increase in adiponectin, there's an improvement in insulin sensitivity, and in some studies also an improvement in the glycemic control. But I don't think we really do know what in the beer it is, what is the mechanism of action, whether it is the alcohol or the hops, what hops is, or others. We really do not, we are not able to pinpoint one or two factors, not to my best knowledge. But I would say coffee, that gives exactly the same. When you are looking upon Parkinson, it is reducing by 25%. There's a reduction in depression. There are also studies showing that there is a reduction in Alzheimer's disease. So maybe the bioactive substances are playing a major role.
Okay, thank you very much. I think I want to thank you, both of you. I think it was extremely informative, and on my way back to Copenhagen, I would consider to have a beer now. Normally I would have some water, but only if I remember to drink the beer. So thank you very much.